but we want you each to feel comfortable, once again, to immerse yourself, but confidentiality of each other's performance, that once we leave here, we're not going to talk about anyone's performance. It's just that learning environment. And the other thing we talk about with confidentiality is that piece of information, that not really talking about the scenario, because we're going to have other refresher courses come through and they'll have the same level of surprise, if you will, or just learning about the case for the first time. So it's kind of the HIPAA simulation, if you will. So those are all very important. When we did the orientation this morning, we talked to you about the room. We were able to listen to the mannequin's lung sounds. As you know, the mannequin breathes, has lung sounds, breast sounds, oh, that is lung sounds, right? Heart sounds, bowel sounds. We palpated pulses. We could feel it in the wrist, in the carotid, as well as in the feet. Our patient blinked, right? So that's the other thing to keep in mind. Their eyes will open and close, they'll blink. If they're sleeping, they may have their eyes closed. We did listen to the heart sounds and the lung sounds, so we know the mechanical aspect of the computer, so we gave you the opportunity to listen to that, so what a normal sounds like. So if today, this afternoon when you go in, if it sounds a little bit different, you can get clarity from us and say, I think I'm hearing some wheezing, or I think I'm hearing rails, and we can provide that clarity. Because we know there is limitations to the mannequin. While they can blink and breathe and do all those things, their skin color doesn't change, the temperature doesn't change. So I'll be in the room and I'll be able to provide additional support. The other part of in the room is our co-facilitator for today, Melanie, is going to be behind that one-way mirror behind there, and she's going to be running the computer, driving the vital sign changes and things on our patient, okay? You may see I have a headset on. We may be talking to each other. Please know we're not talking about you or your performance. She's just telling me what, maybe asking a question, if you did this, or did she see this, that kind of thing, because I'm the eyes and ears in the room, so we're communicating. So please don't feel intimidated by the headset. It's just us communicating with each other. Also want to remind you, when we go in, we had the medications out on a table, so we do want you to go ahead and draw up the medications, and you can administer them in the mannequin's arm, just like we did this morning. There is a crash cart in there if we would need it. And we also used the phone on the wall, so we pushed it and dialed the number that was visible there. So that's something about the equipment and the environment in the room, okay? I think the most important thing before I give you the case scenario is just once again reminding you that this is a safe place, that we want you to feel safe, to be able to immerse yourself, and to really get the best learning from this experience today, okay? So here in a few minutes, we're gonna go into the sim room, and we're gonna see Miss Pauline again. As you remember, Miss Pauline, she's 68 years old. She's post-op from total knee replacement. You know that in our previous scenario, we worked with her and with pain management. She had some reactions, medication, and it ended up that based on some of the med administration, she had an adverse reaction where she became not as responsive, right? We have since called the rapid response. We have worked with her, she's improved, and now it's post-op. It's later in that day, and it's about 7 p.m. post-op day 1, okay? So everything has gone well since we identified the problem. We called rapid response, and we were able to reverse her meds, okay? The provider team, the medical team, has decided that since she was kind of hard to medicate and we weren't quite sure the best route, pill versus IV, that they have decided to give her a nerve block. So she has a continuous nerve block that is infusing, that is helping with her pain management, okay? If there's not any questions, are there any questions? Okay, then we're gonna go ahead into the sim room and we're gonna go ahead and get started on our case.